Hello, everyone. I'm Pauline Lee with UCSF Family Services. With me here today is Family Services Director Natalie Larson. Thank you for attending this afternoon's webinar, How to Plan for Medical Care for Yourself or Loved Ones, Practical Tips from the Prepare program. We want to give a very warm welcome to our presenter, Rebecca Sudore, MD, a professor in the UCSF Department of Medicine, Division of Geriatrics. Dr. Sudore is a geriatrician, palliative medicine physician, and clinical investigator. She's also the creator of Prepare, a free, easy-to-use online program that streamlines the advanced care planning process. You'll learn more about Prepare during Dr. Sudore's presentation. This talk is being recorded. Next week, we'll email the link to the recording to everyone who signed up for this webinar. We'll also post the link at myfamily.ucsf.edu. If you have questions during this talk, please type them into the Q&A. Now I'll turn it over to Dr. Sudore.
Great. Well, thank you so much for having me here today. I'm going to go ahead and share my slides. Okay. Folks thought it might be helpful just to hear a little bit about my background. I think as Pauline was saying, I am a physician who takes care of older adults in geriatrics and people with serious illness, so people who have palliative care. And I've been a researcher for the past several decades, really looking at things like health literacy, patient empowerment, caregiver empowerment, how we can help people with informed consent and really understand the medical care that they're getting, and really engaging the community in research and in these materials, including the Prepare program. I can tell you that I have no conflicts of interest, and as Pauline was saying, the prepareforyourcare.org program is free to the public. So I thought it'd be important, maybe we could just take a moment and ask, why is care planning important? And I like this cartoon that says, once you've been caught in the headlights, life seems somehow inexorably changed. And I think if you've been a caregiver or a clinician at the bedside, you might resonate with this cartoon. I think these two sort of pictures actually also depict kind of what I sort of know on both sides of this equation, that families and clinicians are really often desperate for any information about the person and about what is most important to someone as they're going through serious illness. And oftentimes that can come from the person themselves, which is wonderful when that can happen. And oftentimes it actually has to come from families, friends, and clinicians are really looking to them to help make sure that people are getting the medical care that's right for them. And some patients have described sort of the process of having serious illness in our healthcare system like flying down a broken highway. And I thought I would use this analogy to kind of talk about, where does advanced care planning fit? Because advanced care planning doesn't fix all the problems and all the ills of our healthcare system, but it can still help. If we're thinking about what do we want? What's the destination? The destination is that people get the medical care that is right for them, that is right for you. The road, which unfortunately is often broken, is our US healthcare system. So this might be insurers or CMS, Medicare, Medicaid. The car might be the type of access you have. Maybe you have access to Cadillac care, or maybe you have a Pinto. And unfortunately, that's the sad fact in the US. And then who's driving the car and who's in the car with you? Are you driving the car and you're getting help from family and friends? Or are your family and friends maybe taking the lead and driving that car and working with clinicians? And then this is where advanced care planning or care planning falls in, where this is the GPS or the map. This is helping us figure out where we want to go. And we might need to reroute because there's a big pothole in the middle of the highway, but at least we know what the destination is. And then there are things like roadside assistance that we hope to get from clinicians and from palliative care, which I'll tell you about a little bit later on in this talk. So the objective today are to start with some definitions. I'm going to talk a little bit more about care planning and what it is and what it entails, and then really end with some practical things and tell you about our programs, Prepare for Your Care and Prepare for Their Care. I know some of you shared some of your questions already during registration, so thank you for doing that. I hope that I can keep them in my brain as I'm going through to kind of answer them as we're going. But as Pauline said, as questions come to you, just put them in the chat. I'm going to go ahead with my talk as we're going along and try to save a big chunk of time at the end so we can answer all of your questions. So let's just start with some definitions about what is advanced care planning. I will not bore you with the academic details about how this has been changing a lot over time, though I will come back to this just a little bit in the next section. But if we just talk about what is it, it's sometimes called medical planning. We call it medical planning on the Prepare website, or it's called care planning. And it allows you to have a voice in your medical care. And some of the tasks that you can do related to advanced care planning include naming a trusted person to make decisions in case of an emergency. This person is sometimes called a surrogate. You may have heard of something called a power of attorney for healthcare. And in our Prepare program, because patients in the community wanted us to, we call those people medical decision makers. You can tell this trusted person or persons and clinicians what's important to you in your life and for your medical care. And if it's right for you, you can record that person and your medical wishes in an advance directive form. So what is an advance directive and some of the other forms? And this came up in one of the questions. What's the difference between an advance directive and living will? And we'll get to that here. But an advance directive is a legal form that lets you have a say about how you want to be cared for if you cannot speak for yourself. If you can speak for yourself, it doesn't matter what you wrote down. What you say really will always be front and center. So this is really if you are in a situation where you can't speak for yourself. And this form, this is a picture of the Prepare California Advanced Care Healthcare Directive. You can write down, Advanced Directive has both the ability to write down who you want your medical decision makers to be and your preferences and wishes for medical care. A durable power of attorney for healthcare form allows you to do just that. Name a surrogate medical decision maker, that person to make those medical decisions, but it doesn't allow you to write down your healthcare wishes. And the same thing with a living will. A living will let you write down your wishes for medical care, but won't let you write down your wishes for who you want to make medical decisions for you. In California, they combined those two things into one form, an advance directive. If you live or have lived in other states, sometimes they separate them out, but you can combine them into one advance directive form. You may have heard of something called a POLST form, which is a physician orders for life-sustaining treatment. So this is resuscitation orders that can only be written by a medical provider. This is not something that you would fill out yourself or you would fill out for your family members. This does not designate a medical decision maker. So one of the questions was, I have an advance directive. Do I also need a DNR order? The benefit of this POLST form is that the emergency medical system, it's usually hot pink. The emergency medical system knows to look for this hot pink form. It's really only focused on, are you going to do resuscitation like chest compressions and things like that if I no longer have a pulse? That's the only thing that's really on there, a few other things. But to be safe, if it's really important to you, you can have both. The advanced directive, and I'll talk a little bit more about our advanced directives, really give a bigger scope and a holistic view of someone as a person and what their values and goals are. Because oftentimes in a clinical context, it's not just about resuscitation, it's about all the kind of medical care that somebody might get. But this pink form, the POLST, just focuses on CPR and cardiac arrest. Okay, so a little bit more about advanced care planning or care planning. So I just want to, let you know that the outdated goal of care planning has been in the past to have patients make only end-of-life treatment decisions like that CPR on the pulse form in advance of serious illness. When all the laws sort of kind of came together in the 1990s and the lawyers sort of got together, they thought, oh, we'll just create this advanced directive form with these check boxes, and we'll just ask people, do you want to be resuscitated, yes or no? And we'll just check off the box, and that will fix all the problems in healthcare. And it doesn't. And because making a decision about CPR is only one of many, many, many decisions that people might need to make when they're going through serious illness. So just to let you know, care planning is not only about end of life, and it's not only about CPR. So the problems with only focusing on this treatment checkboxes is that most of these forms, like that PULSE form and many other legal advance directives, really focus only on these medical procedures and not what matters most to people. And I have to say, as a clinician at the bedside, we often, again, are desperate to know why people chose what they chose and what their values are. These forms are not always available when they're needed. With the electronic health record and things like that, that's getting better, but it's not 100% for sure. We know that if somebody has a checkbox like the PULSE form, those can be really helpful when somebody is having cardiac arrest. But when you then ask clinicians or caregivers if they know what kind of care somebody would want other than CPR, it really doesn't improve knowledge, even more than chance, flipping a coin. And this is without having a discussion in addition to the form. And forms alone do not prevent surrogate stress and conflict. So I want people to know that you can't just fill out a form and walk away. You have to have conversations with your family and friends and with your providers in order to put all of this into context and to prepare the people who might be making decisions for you. So I think the other thing that's important to think about is that if we focus only on treatment decisions, some of the reasons this is flawed is because of prediction, adaptation, and extrapolation. What do I mean by that? There are many sociologic and anthropologic studies that show that people do not know and cannot predict what they're going to order for food at a restaurant or buy at the store 30 minutes ahead of time, much less the exact treatment that they would want in every single condition or context. So I think that's important. There's adaptation. You might hear people say, oh, if I were in that medical situation, that's it. I'd never want to do that. Just, let me go. But then we as humans oftentimes can adapt to, say, new disability or new diagnoses or new treatments that we thought that maybe we couldn't. And I would say the reverse is true. Some people who thought they could adapt can't. So those things are variable. And then extrapolation, and I think this is a key point, and it gets back to the check boxes and the CPR. People over the course of their life, when they're healthy, when they have chronic illness, when they have serious illness, and when they're at the end of life, are making many, many treatment decisions. And just because you checked off a box about CPR doesn't help you or your family members or clinicians know, well, do you want to start that chemotherapy drug? Is that blood pressure medication right for you? Is it time to maybe move somebody to a nursing home? All of those other decisions that need to be made that are really hard. There's more to advanced care planning than just that checkbox. So this was a quote from one of our many focus groups with people in the community. This was someone who was making medical decisions for her husband. And our advanced directive is enough. So it says, we got the DNR, which is the do not resuscitate in writing, but in making the decisions, which there were many, that was just one. Because the first decision was to put him in a nursing home. We were married 30 years and I could no longer take care of him. Then the second decision was whether to put him on a feeding tube because he had stopped eating and I wasn't ready to let him go. So just to say that there's a lot involved here. So some people will say, well, why don't you just designate a surrogate decision maker? Again, that's something called a medical decision maker or a healthcare proxy. The problem is that research shows that surrogates often do not know they were chosen. Again, people fill out these forms and then they never tell the people that they wrote their name down on these forms and that they might have to make decisions for them. Again, without a discussion and just a form, knowledge of patients' preferences are really no better than chance. And I think that this is a really key point because I've experienced it myself, I've experienced it in my family, and I've experienced it at the bedside. But when surrogates or medical decision makers are not prepared, they walk away from a lot of these situations with stress, anxiety, and studies are showing post-traumatic stress syndrome. So I think it's really important that we think about how we can prevent that burden and that stress that happens for surrogates. And I think that we also know that surrogates use their own hopes and desires and needs when they're making decisions for other people. So I'll just tell you to illustrate that point, a story about my grandparents that I actually wrote about in JAMA because it was such an impactful thing on me and the development in my research. So my grandfather, long story short, had broken his hip after Christmas many years ago. He was a diabetic. He had heart problems. He had kidney problems. He went into the hospital. They fixed his hip. They made him immobilized and they sent him to a nursing home. And by the time one of the doctors saw him and checked him out, he had what are called stage 4 decubitus ulcers to bone in both of his heels, meaning that his skin was gone all the way to his bones and he had infections. And he spent the last 6 months of his life back and forth to the hospital, getting dialysis, going for surgeries. And nobody had had a conversation with him. And I was in my training at the time. I didn't want to have this conversation, but I felt like I really needed to. And my grandfather was very clear that I'm tired. I am not afraid of dying. No breathing tubes, no shocks, no pushing on my chest. Please, I'm done. Please just let me go. And I turned to my grandmother who was there, who was tearful. And I asked her if she had heard what my grandfather said. And she said yes. And I asked her what she would do if my grandfather's heart were to stop beating or he were to stop breathing. And she said, well, of course, I would tell the doctors to do everything possible to keep my husband alive. And I thought, oh no, what's going on here? We just had this 45-minute conversation, but I'm going to come back to this case when we talk a little bit about surrogate leeway and flexibility. So taking all these things together, that check boxes are not enough and what do we need to do? We actually published a paper in the Annals of Internal Medicine called Redefining What We Mean by Planning in Advanced Care Planning. And what we're calling for is really not only to think about life-sustaining treatments, which are important, but also how can we prepare people for communication and medical decision-making that's going to be happening over somebody's life course. So I'll just tell you too, there's been a lot of, I won't bore you to tears, but there's been a lot of research and a lot of discussion going on in my field about what is the goal of advanced care planning. And if we were to give it a definition, what would the update be? And here it is, that advanced care planning is a process. It's not a one-time event. It's not one form and it's not one checkbox. But this process over time supports adults at any age. Somebody was asking, when should I be doing this? Any age and any age of stage of health in understanding and sharing their personal values, life goals, and preferences regarding their current, what's happening now, and future medical care, and that it prepares them and their medical decision makers for communication and medical decision making. And sort of that concept of care planning, that it really should be tailored for different stages across somebody's life course. So again, somebody asked, when do I start this? Well, when kids go off to college, they're asked to write down an emergency contact. That's advanced care planning. They're doing care planning. They've named somebody who somebody would contact if something were to happen. So they've already started the process. And I think when people are healthy, that's maybe a good place to start, is thinking about, if something did happen to me, if I got hit by a bus tomorrow, who's that person that I trust to make decisions for me? Somebody also asked, well, what happens if I don't have somebody who can make medical decisions for me? I think for those people, that could be because there isn't somebody in their life they trust, or somebody isn't age appropriate yet, because you have to be over 18 who can make those decisions. You can still start thinking about what's really important to you. Maybe when you're healthy, you're thinking about things like, will this diabetes medication help me get the quality of life that I want? Maybe when you have serious illness, you're asking yourself, will this hospitalization for my heart failure help me return to live the life that I want to live? And you might be having different decisions when you're maybe at the end of life. So all this to say, there's no one size fits all. You can start very early, and you can start even if you don't have a potential medical decision maker. So what do we know about care planning and preparation benefits? Well, we know that it prepares patients and caregivers for decision making. It improves satisfaction with communication with all the medical staff and with medical care people receive. It ensures that patients get the medical care that they want. The only way that you can get the medical care you want or get the medical care that your loved ones want is if you can advocate for yourself in this way. And it actually has shown to decrease caregiver burden, that PTSD, and complicated grief. But unfortunately, here are the realities. Only about a third of people actually do advanced care planning or care planning. And that's been about the same for the past 10 years. We know that it's lower among racial and ethnic minority populations. We know that only 10 to 20% of people discuss their wishes with clinicians. So they might be doing this stuff at home, but it doesn't really necessarily translate into having these conversations with clinicians. And we know that people who die in the ICU, about 20% of them don't have advanced care planning on file before they die. So what are we going to do about it? So I'm going to now tell you a little bit about Prepare for Your Care and a little bit about how we set up this program to sort of help with some of these things that come into play. So Prepare is an online, secure advanced care planning program. It has videos and easy to read advanced directives. Over here on the left is what the homepage looks like. You just have to type in prepareforyourcare.org and you will see this. On the left-hand side is have a voice in your medical care. So that's if you want to do your own care planning. And then here, help other people. This is if you're a caregiver or you're wanting to know, boy, how do I start these conversations with other people? Prepare is based on decades of research, and it was co-developed with patients, caregivers, and communities, and really addresses things like literacy, language, culture, and caregivers. So what do we mean by that? When we talk about health literacy, this cartoon says, you don't call this a legal document, do you? I can understand every word of it. And I think that that's what we were finding when we looked at a lot of other advanced directives, as you'll see here. This is the standard California advanced directive. We know that the average reading level in the US is only at the 8th grade level. And for Medicaid and the elderly, it's actually at the 5th grade reading level. But most of all of these forms are written well beyond a 12th grade or postgraduate reading level with teeny tiny font and legal language that makes it really scary and hard to complete these forms. Digital literacy, we had to sort of think about that and how we could create the website to make it easy to use. 73% of older adults and growing are using the internet, but only 60% can fill out an online form. So we had to make this super easy. And then language, we know that 61 million people speak a language other than English at home, including 40 million Spanish speakers and 3.4 million Chinese speakers. And I think it's really important that we talk about culture and racism. And this came directly from our communities who told us that many of them hold what we call non-Western views on autonomy and decision making. And what I mean by that is we find in our research that about 20% of people will report that they don't want to make their own medical decisions. And 20% report that they do not have a trusted medical decision maker. So taking those two things into account, we had to create a program that would allow people to help, let other people make medical decisions for them and address the fact that some people don't have a medical decision maker. And again, that's a normalized thing. At least 20% of people will report that. And I think it's really important that we, name that there's a lot of experiential racism in our health system, and our health system is not trustworthy for many people. And so we had to be able to create things that people could do in their own homes, in their own communities, even if it's outside of the clinical environment, and tools to help people have conversations, because we know that many people may not want to actually fill out a form. And I think it's really important when we thought about this program is to talk about what matters most. So what matters most is not the treatment, but the outcome of treatment. And this little picture here is a cart before the horse. I can tell you as a physician, I was always taught the cart before the horse, which is I was taught to start by asking people, do you want intubation, meaning a breathing tube, or CPR, which is the cart, instead of starting with, how do you want your life to be after that treatment, or the horse? That's what's really important to people. And this quote from one of our caregivers brings this up too. Are we reviving him, sticking the tube in so that he can suffer more? I guess it goes back to what happens if you revive him. Is he going through that whole process again? It's the end result. And so thinking about in our program how we can help people think about, well, what matters to me and how do I ask the right questions? If a doctor is telling me I should do this or I should do this for my loved one, really, what's the end result here? And then this question came up, ahead of time as well in terms of surrogate leeway. So this is a really important point. So surrogates may need to make decisions that conflict with patients' prior preferences on those forms. Some of those forms they may have filled out 10 years ago. And, here some examples are maybe somebody can't honor somebody's wish to die at home because it may be unsafe or they can't help with that person's symptoms. Or somebody might be asked to withdraw care or actually asked to accept care because somebody may benefit from transient treatment. And things and contexts can change. So what the research is showing is that surrogate, again, this is the medical decision maker, their burden can be eased by giving them permission to consider factors other than just prior wishes on a form in the moment decision making. And this is called leeway. And the thing is, you can't have leeway without having had multiple conversations with somebody ahead of time about their wishes. If they're just given a checkbox form, you can see how this would be really hard to do. And this gets back to my grandparents. And this is really where I learned about leeway. If you remember, my grandfather said, let me go. My grandmother said, I would tell the doctors to do everything possible. When I turned back to my grandfather and I said, what are we going to do here? He said, I'm ready to go, but if it helps your grandmother to feel that she did everything possible for me, even if it's because she doesn't want me to go, that is okay. She's the one that has to go on living with her decision. If this is what she wants, then this is what I want because I love her. And at this moment, this is an extension of my own grandfather's autonomy. He was giving my grandmother flexibility to make her own decision. But if we hadn't had this conversation at his bedside and really clearly discussed it, you could imagine what would happen when my grandfather told me one thing and then my grandmother came up with something else when he actually did die. So, and I will say that this was a really hard situation, but my grandfather did wind up, going into cardiopulmonary arrest in a nursing home. He was resuscitated. He never regained consciousness. My grandmother felt like she did the best that she could for him. And it opened up the door for me to have a conversation with her about her medical wishes. And she was very clear that she wanted to join my grandfather. So just an example of flexibility and leeway there. So I think what we've learned from the community is that what people need and what they told us that they need is that we need to prepare them with skills. So how do you basically identify what is most important and how somebody wants to live? How do you talk to family and friends if they're available? How do you talk to medical providers? How do you make informed decisions? How do you get the care that's right for you? And how do you prepare caregivers? And again, we wrapped this all into the Prepare for Your Care program. And again, this is based on that new and improved advanced care planning model that's not just talking about life-sustaining treatments, but really how do we prepare people for communication and medical decision making. So if you go to the program, I'm just going to go through some of the slides so you'll know what you'll see when you go there. We really were focused on what, who and what do people value and why. So Prepare uses video stories and easy to read advanced directives to help people make medical decisions based on their values. It walks people step by step through a 5-step process. People don't have to do all 5 steps. You can pick and choose. You can just do one. You could only do 3. You can decide which steps are right for you. But step 1 is choose a medical decision maker. Step 2 is decide what matters most in life. Step 3 is choose that flexibility or leeway for your decision maker. 4 is tell others about your wishes. And 5 is ask doctors or other medical providers the right questions so you can get the medical care that's right for you. So the cornerstone really of the program are what we call these how-to videos. We didn't want to just say, hey, why don't you go choose someone to be your medical decision maker? Or, hey, why don't you go tell them what's really important to you? We really wanted to show people how. So there are videos such as how to ask someone to be your medical decision maker, or how to ask doctors the right questions. And the entire website and all of our videos are written at a 5th grade reading level. If people want it, there's narration that will actually narrate the text. If people have difficulty seeing, and there's closed captioning for all the videos, as well as transcripts of all the videos if you prefer to read rather than see a video. And the website actually integrates easy to read legal advance directives for all US states in English and Spanish and a growing number in Chinese. We were talking earlier that in California, there's actually 11 languages that there is this form. We work with UC Law, who helps us to make sure that these remain legally valid, even though they're written at a targeted reading level of the 5th grade. And these advanced directives may look different than what you're used to. So it's not just a checkbox again about CPR, but really focuses on values and space to write why somebody might have chosen something. And I have to say, as a clinician at the bedside, I'm often interested in the why, because the why helps me to recommend medications or treatments that make sense for that person. So for example, there's a question, what matters most in life? And quality of life differs for each person. Is it your family? Is it pets? Is it volunteering? Is it religion or spirituality? There are things such as what things would be very hard on your quality of life, such as being in a coma or not being able to take care of yourself. If you were at the end of life, what things would be really important to have around, such as food, music, pets, or the people that you want. And then plenty of space to write what else your medical providers and medical decision makers should know about you and your choices for medical care. There are many ways that you can complete this advanced directive. So as you're going through the 5 steps, the program will ask you questions. And if you answer those questions, it will actually pre-populate an advanced directive for you. So you don't have to do both. It'll just automatically do it. You can actually also just go straight to the advanced directive, and you can fill out that advanced directive online, and the program will walk you through it and give you helpful videos as you're going through. You can also just download it and do it with pen and paper. So we know that this Prepare program makes advanced care planning easier on patients and clinicians, and it's proven outcomes in randomized trials. Again, I'm not going to get into the weeds in our research, but just to let you know that we've done a lot of trials. We've looked at about 1,400 English and Spanish speaking older adults. And in these trials, we gave things to patients. We did nothing for the clinicians. We did nothing in the healthcare system. And we wanted to know how much bang for our buck could we get if we empowered people with easy to understand information. And we found that this easy to read information primes people and helps to decrease disparities in advanced care planning. So after reviewing our materials, 98% of people were able to engage in some form of advanced care planning. And when we looked in their electronic health record, the documentation in the electronic health record increased from 8.5% to 43%. But this next result is probably the thing that is most important to me. We actually audio recorded and observed primary care visits between the patients and their doctor after they saw our Prepare program. And we saw a 50% greater, what we call patient empowerment, where patients were speaking up for themselves and telling the doctors what was most important to them. And not surprisingly, there was 50% more clinician responsiveness to their questions and concerns. And we found that there was a 50% increased goal concordant care, meaning that patients reported they were getting the care that was right for them. We've also, been doing this in the health system here at UCSF. So for any researchers or clinicians in the audience, we've been doing this in primary care with about 10,000 patients. And we've increased the advanced care planning documentation quite a bit, from 18% to 69% for all patients in our DGIM clinics, and that increased to 91% for people who are seriously ill. Again, for all of the providers who might be in the audience, there are tools for providers and organizations, and those include things like quick start guides for patients and pamphlets. People can put on group medical visits. There's a toolkit for that. This can also be used for community events. If there's any community organizations, you can download this and put this on at your institution. We've done them in libraries, in churches, and senior centers. And for anyone who wants to start having these conversations, whether you're a family member or you're a clinician, we have something called simple scripts. So simple advanced care planning scripts for everyone that you can just read to start those conversations. Okay, I want to end here by talking about Prepare for Their Care. And this is really for caregivers or people who might be making decisions for someone else. Again, if you're on the home page, that's this button here in blue. How do you help other people? And click here to learn how to help other people with their medical planning and decisions. And I'll tell you, for years, while we had our Prepare for Your Care program that allowed people to do their own advanced care planning, we've been hearing from people that said, I really want to bring this up with my mom, but I don't know how to do that. So how do I do it? And then we also heard from other people who said, you know what, my loved one has dementia and can no longer make their own decisions, or my loved one's in the ICU and I don't know how to make these decisions. So we created a caregiver program, and that's Prepare for Their Care. It's also targeted to the 5th grade reading level. It has videos that walk people through things, and it also has the closed captioning and the transcripts. So you can see that there are 2 parts of the program: how to help other people with their medical planning. And this is when someone can still speak for themselves. There was a question that came in: if a parent is starting to show signs of dementia, how can I get them, or should they be engaged in advanced care planning? I would say that it's the perfect time to get somebody engaged in their advanced care planning at the first signs of any kind of cognitive impairment, before it gets to a point where they can't make medical decisions for themselves. And I will say that many people have dementia, but that doesn't mean that they don't have the capacity to make an informed decision about their medical care. And just an example about that, because it came in as a question, I had a patient who had very advanced dementia, couldn't take his medications, couldn't live on his own, needed reminders for everything. But every single time, and I'm talking over years, I asked him the same advanced care planning questions. He said the same exact thing every single time. So I think if somebody can tell you, on multiple occasions, the same thing, and it's consistent, and they can tell you why they're making that decision, that usually is a sign to us that somebody still has capacity to make decisions for themselves. So hopefully that answered that question. But there's also how to make medical decisions for other people when people cannot or do not want to speak for themselves. So I'll just show you some of the videos in those sections. So this is if you wanted to help other people with their medical planning. Some of the things that we heard, again, are important ways that planning is different for each person, and how they want to be involved in the process. how to bring up the topic of medical planning with words you can say, with some examples that you can watch people actually doing this, how to ask other people about their medical wishes, and how to help other people write down their medical wishes. And it'll show you actually how to use the Prepare program so you can help your loved ones actually complete these forms. Some of the bonus videos are what to say if you learn that you are not the decision maker. We find this a lot, that someone has been caring for someone, but they wind up writing somebody else down on their advance directive. And so I think that's important to sort of think about. And then what to say if you do not want to be the medical decision maker. Situations have happened where somebody's been asked to play that role, and that's not a role that they want to play. And then when you're making decisions for other people, these were the videos again that caregivers in the community helped us create. How to ask the medical care team the right questions, how to make medical decisions for other people. Then once you've made medical decisions, sometimes you have to update your other family and friends, and that can be hard. So how to talk about decisions you made for others. There's some advice from other medical decision makers. And again, some of these bonus videos. So how to help even if you're not the medical decision maker, how to ask somebody else to take on that role for you. And this was really important, what to do when families do not agree. I just wanted to point out that there are other things that you'll find in this program if you want to learn more about medical planning, as we've been talking about today. If you want to know more about advanced directives, if you want to know, more about terms, or there's a whole section on frequently asked questions and other resources, that can be helpful. And then I just want to take a moment and talk about palliative care and how it can help if you yourself are dealing with serious illness or if your family member is. Palliative care is a specialized medical service that helps people with serious illness live as well as possible for as long as possible. So providers have special medical training to provide an extra layer of support for people at any stage being treated for any type of serious illness. It could be serious illness that has a cure. It could be serious illness that will be going on for many years, and it could be serious illness that might be terminal. The team usually includes doctors, physician assistants, nurses, social workers, nurses, chaplains, psychologists, case managers. It's sort of this holistic team of people to come support you if you or your loved ones are dealing with serious illness. So if that ever happens to you, I recommend asking for their help. I wanted to end just by telling you about this other resource. I am not a lawyer and I can't answer legal questions, but if you have other legal questions like wills or trusts or a durable power of attorney for finances, our colleagues at UC Law created planforclarity.org. So it's a website designed to help people make financial and legal plans so they're prepared for a time when they may need help. So if you're interested in any of that legal stuff, this will again be in the slides, which will be made available to you. Okay, and with that, I'm going to go ahead and end. I just want to remind people that Prepare is free to the public. So you can definitely use it for individual use. We do license our materials for organizations to help them with their advanced care planning programs. And as always, we are open to donations so we can keep our program and keep it free to the public. But I will end there and take some questions.
Our first question is actually a series of questions. So I'll read the whole thing to you and then we'll go one by one. If I'm from another country, are the options available to me? Are there additional documents needed because I'm not a US citizen? Can I assign a non-family member to be my advance directive person since my family is abroad while I work here? Do you advise that I assign someone in the US to be my advance directive person?
Great questions. Did you finish them all?
Yes, I finished them.
Okay.
First one was, do I, if I, if I'm from another country, do I have the same options?
Yes. Yes, you can absolutely fill out one of these forms for sure. It probably does make sense that you choose your medical decision maker to be someone that is actually here in the States. In case, the doctors need to be able to contact them. So that's probably a good idea. Um, did I miss anything else?
Are there additional documents? Are there additional documents for someone who's not a US citizen?
No, all of the legal requirements are the same. So in the state of California, if you were to complete one of our easy to read advanced directives require two witnesses or a notary, not both, one or the other. And as long as you have that, the forms will work.
Thank you. The second question is, are there prepare resources for other states or is it limited to California?
Yeah, if you go and you click on the advanced directive, the very first page that you'll see, there's a drop down for all US states. So, we have people that they call themselves snowbirds, right? That might be spending half the year in one part of the US and half the year in another. It's easy to, if you filled out the form online, you can download one that's from Georgia and one that's from California. And if you have any family and friends in other parts of the country, this is a nationwide program. And the caregiver program, is state sort of agnostic, so it can be used really by anyone.
Thank you. Um, are there resources on how to pay for long-term care? Is that addressed in one of your videos?
No, I wish I knew how to pay for long-term care. There's some information on that in the planforclarity.org, that last slide that I showed you.
Okay. Oh, I'm sorry. Let me just scroll back up. On one of your slides, what does W/D mean?
Oh, maybe it was withdrawal.
Oh, okay, all right.
Mhm. Sorry about that.
Oh, no problem. What is considered Cadillac versus Pinto care? Is it PPO versus HMO?
I think it's whatever that means to the person. I'm just using it as an analogy, but I think I think what's hard about our health system is that some people have access to more resources than others. And that's just a sort of the reality. Some people, have a PPO and some people have amazing health insurance and some people don't. And so advanced care planning, like I said, it's part of it's a really important piece of the puzzle, but it doesn't fix some of the healthcare access issues that we might have in this country.
Sure. This is another question about finances. Okay. My only real question is where does the money come from for senior loved ones who need daily medical care but have no money? Social Security does not cover it, and nor do pensions. Um,
Um, I really wish that I could tell you. I mean, I think some of the things that it might be repealed are some of the caregiver benefits that were approved through the Biden administration to try to help caregivers, family caregivers, particularly who've been taking care of loved ones. I will say if people do not have if this is coming up for people, I would recommend going to their healthcare provider, seeing if they could be hooked up to speak with a social worker to see if they might be eligible for people who are eligible for Medicaid. There are things called in-home supportive services that will pay for a certain number of hours to get additional help. Many people are unfortunately in that middle section where they don't have enough money to pay for it out of pocket and they're not indigent enough to actually, qualify for in-home supportive services. And so they're kind of in the middle. But I would say that to reach out to social workers and see are there any of these programs that you might be eligible for? But it is tough and it's happening to me. It's happening to a lot of people that I know.
Thank you. Next question is a longer one. My mother has Alzheimer's and multiple doctors that she and I work with, primary care doctor, cardiologist, neurologist, etc. Who shall I share her pulse and advanced care directive with? And how do I ensure that each doctor has access to these documents as she sees some doctors that use an EMR and others that don't?
Yeah, it's so hard because unless all those doctors are in one system, say if all those doctors were at UCSF, then you could go to the primary care doctor or, the doctor of your choice. I would say primary care is maybe more trained to have these conversations, and they could make sure that everything gets scanned into the electronic health record. And if the cardiologist was also at UCSF, they would be able to see that form. And if they got admitted to UCSF hospital, they'd also be able to see that form. But, and this has happened to my own mother, if your doctors are in different places in different systems, they do not see, they don't have access. They're trying to improve that. There are called health information exchanges. There's something called Care Everywhere that supposedly you can get in and find this information, but just as a clinician, I can tell you it's very hard to do. So my recommendation is to go to each of those places, ask them to make copies for you, and make sure that each of those providers have the information if they're like for each of the different systems. So if somebody is at one system and somebody's in another, make sure that both of them have copies. And like I said, you don't necessarily have to be on the hook to make those copies. You can actually go in and ask them to help make copies for you.
Okay, I think this is our last question. Oh no, there's more. Um, how different is doing this with Prepare versus the form from the state of California?
Well, I think it is person dependent. I can tell you when we did a randomized control trial with, over 250 people, 99.9% of people preferred the easy to read form, and very few preferred the standard form. It's sort of like if you're going to do your taxes, I kind of talk about it like TurboTax. You can get the big IRS a booklet and kind of go through it, or you can have somebody kind of help you walk through it a little bit more. Some people like reading legalese and going through those documents, and that's their own preference. But I would say the majority of people sort of prefer having just easier language to get to. And I would say we've also found this because sometimes this can be an emotionally charged topic to talk about. Having something that's targeted more towards the fifth grade reading level that's just easier to read seems to help with that as well.
And what I thought was a question is actually a comment. There was an attendee who said wants to express her thanks for the fact that you mentioned the Center for Medicare and Medicaid Services. She said she wasn't aware this actually existed, and it's very helpful.
Okay.
Okay. Does anyone have any other questions? Let me make sure I covered all of them. Well, actually, I have a question. Um, if you're in a situation where you feel that an older loved one has chosen a agent or a surrogate or a healthcare proxy who might not be the best choice, and how do you approach and say maybe this is not the best choice?
Yeah, well, we have a video for you in that prepare for your care or prepare for their care program. Um, you know, there's a whole one of the bonus videos is what to say if you learn that you're not the decision maker and you might be concerned about the decisions they make. So you can go to the program and read the transcripts or watch the video to see how you would have that conversation because it does come up.
Does anyone else have any questions?
I think there was one last question. If you're a snowboard, do you do forms for the two states you live in?
Yeah, I think so. I'll just say that most states, but not all states. So I think people are surprised. I was surprised. Every US state has their own laws about advanced directives and advanced care planning. And that's why we have 50 different advanced directives. We'd love to have just one, but we have 50 different ones because all states have their own laws. Most, but not all states have what's called reciprocity laws, meaning that if you're in California and you bring an advanced directive from Georgia, that California would accept it. but that's not the case everywhere. So the safest thing, to be honest, would be to fill out both of those forms and have them when you're in those different, places. And if you see providers in those different places, making sure your clinicians in Georgia have the clinician advance or have the, Georgia prepare advanced directive, and in California have the California version.
I think in one of our discussions, you had mentioned that it's a very quick process to adapt the form for one state to the form for another state. You don't have to fill everything out again.
If so, just to let people know, so again, the program, we try to keep it free to the public. Again, through donations and research and other things that we do. And people don't have to sign in and create a username and password. They can use it as a guest. But if people do sign in, as people are going through, the program will save your answers. So let's say that you are in California and you filled out an advanced directive, and then you decided, oh, I think I'm going to spend part of the year in Arizona. You could go over and just click on, like, it'll save your answer. You just click on the Arizona advanced directive. It's already pre-populated that for you, and you can download it. If you want to sign in as a guest, you just have to do that all in one sitting. So the site won't save your answers, but you can flip back and forth between different states. If you've gone through the program and you've answered all your questions, you can click on many different states and download them all.
I want to thank you so much, Dr. Sudore, for taking time from your busy schedule to share your expertise with us. I also want to thank Educational Technology Services, Brian Cole, for providing support and guidance throughout this event. And I want to thank everyone for joining us this afternoon. Have a great rest of the day.